Hi,
Um,
good morning.
okay.
I am Representative Alma Hernandez from District 3 in Tucson, and I represent everything from downtown University area, all of West Tucson, parts of South Tucson, Bosque Yaqui, all the way up to right before Marana. I am also a very proud patient of El Rio since I was a baby, and I continue to be a patient there, so I'm very excited to be able to do this with you all. So thank you for joining me, and thank you for wanting to do this for the community. So I appreciate it.
Well, it's our pleasure, and I'll begin the introductions on our side. I'm Doug Spegman. I'm an internist, chief clinical officer here at El Rio, and I've been honored and privileged to work here at El Rio for the last 26 years. So, Sudha?
Yeah, hi, I'm Sudha Nagalingam. I'm an infectious disease physician by training. I've been really honored and blessed to be working at El Rio for the last 5 years.
And I'm Brenda Goldsmith, and I direct the foundation here at El Rio, and I've been with El Rio for 15 years. Good morning.
Good morning. So thank you for doing this, and it's great to see you all. I appreciate the work that you're doing to keep people in our community safe, especially in the community that I serve. A lot of our community members are patients at El Rio and other community health centers just like El Rio. So I want to thank you for the work that you're doing. So my background is in public health, and I hear a lot from constituents constantly. They're asking questions in regards to COVID. A lot of patients, I know that you've seen a decline in patients going in person. A lot of patients are a little worried at this time because they're trying to figure out, can I still continue to go on my routine and go see my doctor for, the checkups that I need when they're not related to COVID? And I think that's one of the things I'd like for you to kind of help us answer, because I know that you're still open and running, and I want to make sure that people are still seeking the services that they need during this time, especially when we have people who are diabetic and suffering from other issues that they need to be seen by their doctors. So can you kind of explain a bit of what El Rio is doing to make sure that those patients are still receiving those very needed services, but also staying safe?
No, absolutely. And just like you outlined, we are really concerned for the people when you go into social isolation. We're really concerned, who does that marginalize even more? Who does that isolate even more? And folks who have medical needs, we want to send the really strong message is we are here for them now, and we have created ways that they can reach out and have a telehealth visit, a telephone visit if they feel like they can't connect on a video-like recording. So when COVID came out, our percentage of telehealth visits were really small. Now we are almost back to 100% of the same number of visits that we had before. And about 70% of those visits are all by phone and video. And we are specifically looking at our most vulnerable folks and reaching out to them to call them and encourage them to have these telehealth visits with us. That being said, if someone needs to see us, we also have workflows at all of our clinic sites so that if someone is sick with COVID-19 like symptoms, they get down a track where they go to separate isolation. Those who have other needs will go to what we call clean rooms, clean sites to try to keep those folks separate. So even though we would encourage telehealth, we would also want to certainly tell people we're here if they need to see us physically as well.
Perfect, great. Thank you for touching on that. And I will say I did go on Saturday to pick up medications for my mom at El Rio, and they do a really good job of making sure that they ask you the questions before you even enter the building. I remember getting a green wristband to allow me to go into El Rio to pick up the medication. So I do appreciate the work that you're all doing to make sure the safety not only for the patients, but also for the employees and the health providers, because that's one of the things that's very important right now that we're seeing is people don't really understand, the entire purpose of staying 6 feet apart or not going out if it's not necessary. So I appreciate you mentioning that. I did have another question because we are in Pima County and we're in the city of Tucson. A lot of the folks in that area are wondering what is it that the community health centers and El Rio is doing in partnership with our cities or our counties to make sure that we're all working in collaboration. It's all a team effort, right, to make sure that everything flows.
Yeah.
Can you explain a little bit of what is going on currently, the partnerships or the work that you're doing with the city or counties?
Yeah, that's right. I'll start it off and then I'll ask Suda to continue. So right from the get-go, we in community health centers have always trained in emergency preparedness and incident command structures. So when COVID-19 first became known, we activated our own internal incident command structure, meeting daily, creating workflows and teams to do exactly what you saw when you went to pick up the medication for your mom, to create those tents and those screening stations. But we don't work in isolation. We work with the EOC, the Pima County program to guide the emergency preparedness efforts for our community. And so one of the things that we've done is not just internally, but we've made ourselves available as a public health outreach screening arm for Pima County. And so we've screened hotspots within senior care living and gone with our teams to those to do the testing and screening needed. And I'd like Dr. Nagalingam to talk to that a little bit.
Sure. So just to piggyback exactly on what Dr. Stegman said, we've done a lot of outreach work, and it's really crucial that we do that. Because what we do know is in closed living spaces, so in prison systems, in nursing homes, in homeless shelters, if one person is infected, it's so easy how this virus is to infect and wipe out an entire community. And that in itself can cause a surge in our own community and our hospital systems and our ventilator capacity. So part of our screening, what we did at El Rio, is to identify persons who are positive from those who are negative and implement appropriate infection control processes to kind of help our entire community. So that's been a huge part of what we've worked with our county health department to achieve. And I think on a bigger level, to sort of piggyback earlier in the earlier conversation, a big part of what we do at El Rio is primary care and taking care of the needs of our patients. What we do know is we did not want our patients to end up in the ER or in the hospital because of uncontrolled diabetes, uncontrolled blood pressure. Not only is that utilizing capacity for patients who might need that hospital bed, who have coronavirus, who need ventilatory support. So it's really crucial that each of us as a provider on the team kept our patients healthy and well and out of the hospital system. And I think a big also part of our role with our health department was working with our health partners, all the local hospitals, as well as the medical directors of the health department, to ensure that we were procuring enough testing supplies and PPE, because early on, and it still is the case today, we're very limited in those two needs. And so we've been able to work with our partners to ensure that we're all serving the needs of all of our communities.
And then Doug, you may want to mention too, we're part of the homeless collaboration, and there's a call daily, right, on that as well?
So there's the coordinated efforts are daily calls through the EOC of Pima County. We are part of 3 separate communities. So it's a daily call on ambulatory side of things. daily calls with hospital partners, and then now it's 3 times a week with those who serve the homeless. And out of that, we've entered into memos of understanding of how we, El Rio, will clinically support and staff the shelters and shelter-in-place efforts that are occurring. Just this Monday, we were at the Viscount Hotel, and
also
Salvation Army,
as well as Travel Lodge,
and doing screening of homeless individuals who are now there. One site as folks who are high risk but not known to have COVID contact. The other is for those who have been significantly exposed. So it is always a test of the community on how well we can work together. As a community health center, we see that as not just our mandate, but our obligation to our community to be involved.
Yeah, no, and I appreciate it, and it's really great to know everything that you're doing. One of the main concerns that I've had all along is what are we doing to make sure that our vulnerable populations, our elderly, our homeless, those who are incarcerated are receiving the services that they do need, and if they are infected, what are we doing to make sure that we contain that, right? So I appreciate you explaining the process and the partnerships that you have to ensure that we're not seeing more cases, and hopefully if we do, we catch them early on before there's more spread. So one of the other issues that I know that I've had many conversations with folks, yesterday I was actually on a call with a group of Holocaust survivors who are feeling very lonely, and some of them expressed how this has really taken a toll on their mental health. And I really wanted just to hear from you, because it is, mental health is such one of those taboo things no one wants to talk about, but it's a very serious issue that we are seeing not only in our state, but around the country, is that we have many individuals who are not seeking the services that they need to be able to help them get through their crisis. So what has been the experience? I know that you've shifted a lot, as you mentioned earlier, to the telehealth and the telemedicine part of El Rio's work, but what has been the experience working with those in regards to, mental health and behavioral health issues?
Yeah, so thanks for that question. It's spot on. And I'm pleased to report to you that when we look at telehealth in general, we've made the great gains that I've said. If you look at telebehavioral health, we've gone to 170, 180% what we usually would see in encounters. So through this pandemic, it's become an opportunity to have people available for telebehavioral health, and that above expected encounter rate argues exactly to what you just said. The need is great, but also our capacity currently is also great. So we have, as you know, an integrated behavioral health program within El Rio. So we have 3 psychiatrists, 5 psychiatric nurse practitioners, about 10 therapists, and case managers and supporters. And then we have a large contingent of LCSWs that work around specifically behavioral health needs of those with chronic disease issues. All of those folks in this time of COVID have been able to be on a platform where the receptiveness of those who are now isolated is just through the roof. So the medical patients still, there's a good percentage of them that say, thank you for reaching out, but I don't really need to talk to you right now. On the behavioral health side, it's like the floodgates are open. So again, I'm just very pleased, and we're blessed to be able to say that we're able to meet that need and encourage people to call our contact numbers, because we have a patient communications program where it's all our own people that work for us, and they immediately will connect people to behavioral health, telebehavioral health. And I think that's a fantastic benefit for people who are feeling even more, as I said, marginalized and vulnerable.
And I appreciate that. And one other question before we wrap up. What is El Rio doing, and what is it that the public, like me as a public official, can do to help spread the word about the work that El Rio is doing currently in regards to COVID? And what is it that they're doing, what you are all doing? We have a big population in my district that are Hispanic and Latino Spanish speaking at home. So I would like just for you to explain a little bit of that, because I have many constituents that are constantly reaching out and saying, where can I go, or who can I call for help? And is there someone that can help me in Spanish? Can you kind of touch on that a little bit?
Absolutely. So because this is being recorded and will be a podcast of some sort, the number is 670-3909. And people can call that, and in English, Spanish, those folks are bilingual. They will connect immediately if someone needs to a nurse who can take them through, guide them through what they need. If they want a telehealth visit for medical reasons with someone that they've been seeing, a provider that they have, they'll set that up. If it's a behavioral health, anxiety, depression, they will be the point of contact and set that up as well. It's a one-shop number to get people into it. And for those in our community who for whatever reason haven't used El Rio in the past, we are here as a committed resource for them. And again, in terms of Hispanic, but all cultural groups and all groups who have tried to overcome barriers to care. So LGBTQ community, folks who are living with the fears of am I documented, not documented, who's going to ask what? We don't ask. We just take care of folks who need to be taken care of. And Brenda was mentioning refugee communities from folks from different backgrounds. We have the ability to speak within any language that anyone needs to speak through Siricom, which is they can do it by video, audio, where they will have a translator available. But in terms of Spanish, vast majority of our provider staff, our staff, is bilingual, and when the need is there, we can meet that need.
Well, we appreciate it. If we could just have one takeaway from each of you, one thing that you would suggest people in the community to do, if you want to start the other way, if you want to start from the back and just give us like one thing you would suggest people in the community do right now during this time.
Well, I just want to thank the community, because many people have made masks for our staff and our patients, and we've had over $350,000 in cash donations to help with our pandemic efforts. So I think, find a way from home to socially distance, but maybe to help in some way that you can.
All right, I think my recommendation is just stay at home, continue with social distancing and hand hygiene. It's just something we've always known, but now it's more important. Social distancing saves lives, and that's really the key.
And I would echo all of that, but then also give a message of hope that together we will get through this. Together we have the resources, and that even when we feel that we're being overwhelmed, you know, el pueblo unido jamás será vencido. So we will always be together and overcome.
I appreciate it. My mom says that line all the time. But thank you. I appreciate it so much, and continue to do what you're doing. You are all awesome. We're very proud of you, and we're just really grateful for the work and service you do to our community. So
Well,
thank you.
thank you, but also very much thank you to yourself. So it's committed, passionate folks in the legislative side of things, politically moving us in right directions. So we are very appreciative, and thank you for all you do.
Thank you. I appreciate it.
All right.